What I love the most about my town is definitely the people.
The best part of my job is I love working in backward areas because I feel they really need me.
Meeting people, working with people, harnessing our shared desire for a better city has, without a doubt, been the best part of this job.
Working with our devolved sectors to deliver services to the people of Port Local.
When I make the correct decision for the people that I serve, and I get that good feedback.
It helps bring the best out of you in trying to find solutions to the problems that people have. That is the best part of my job.
The worst part of my job is not having enough resources to promote development at a faster rate.
When the expectations and the services to deliver are so great that the funds available is very, very limited.
So there are some times that you have to make these decisions and then they don't reach the intended people. That doesn't make me happy.
Devastation of lives from the nature disaster. After you see those things happen to your municipality, it is very, very heartbreaking.
I really wish we could do more for more people. That's the worst part for sure. Undoubtedly, the pandemic has crippled our local economy. Many stores have shuttered and far too many people have been made unemployed.
COVID-19 has heavily impacted our town. Businesses have closed permanently, leaving many unemployed. Municipal rates collection slowed down. Access to healthcare was severely compromised.
It has impacted our economies, the economies of our people. COVID has also affected the tax base, revenue base of my council, Port Local City Council.
Health-wise, we focus so much on the COVID-19 and its diseases. We sort of left a lot of the non-communicable diseases unattended to because everybody was focused on the COVID. This also had a toll on us. Some people went hungry. Some people didn't get anything to live on.
It slowed down the business, especially the vending, because you would have much more persons vending, especially for the tourism industry, like on the bayfront.
Poverty comes and unemployment come. It was painful, and during this COVID, I also lost my parents due to COVID. So I can feel their pain.
COVID aside, dengue has been one of the most challenging infectious diseases in our city. Being low-lying and full of swamps, deadly mosquitoes have ample breeding ground throughout the city. We depend on vector control via central government, but we would love for even more to be done to arrest this disease.
Waste management is a major challenge affecting our public health. Until we have a properly engineered disposal site, this will continue to be a great concern for our community.
Waste management is one of our challenges. Since that capacity is very less, most residents in the city ended up dumping their waste. Of course, sanitation is also one of our health challenges, but most hit for local city is second in the area of the HIV and AIDS. Among the infectious diseases that top the chart is malaria.
The challenge is sanitation and waste. The current problem we are suffering is dengue. Lack of capacity, of course, lack of resources. These are hurdles.
The council main focus is on sanitation, especially if we hear we're going to have rain for the weekend. Our inability to raise sufficient taxes is hard because since Maria, it's kind of struggling for us to get people to pay the tax.
This is a rainy season, so we have to keep going out there and do a lot of sensitization on especially waste management, because That is what breeds malaria and also cholera. A lack of financial support. We don't really have good financial support as a local authority. So that becomes a very big challenge.
Clearly, the first thing I'll put my finger on is sanitation. It's one of the challenges that we have. With the amount of water that flows, wherever there's stagnation, you have malaria. So malaria is one of the big challenges that we have. Another thing too is being able to pick the necessary data to help us in our planning activities. Because with proper data, we can put everything together and be able to find the necessary solutions and plan for implementation as well.
This program is timely and very important to us. As municipal leaders, we are the ones on the ground. We are the ones in closer contact with citizens. We are the ones impacted most when public health crisis exists. And so, we believe it's important for our voices to be amplified. We believe that as a coalition of municipalities, we can achieve just that and even more.
Coming together with other leaders to contribute and support in making a meaningful impact towards combating health challenges faced by all local governments is long overdue.
There is strength in numbers. We may not be able to do everything on our own. Joining this means that I'll get the benefit of what others have done, learn from it, and gain some experience. Besides, what we do not have, others can help us to get. And at the same time, what we have been able to gain out of this, we can share with others. Basically, strength in numbers.
To put health challenges of less developed countries on global health agenda, to sensitize the world on health-related policies issue, to learn best practices and share knowledge.
Let us collaborate with one another to build a stronger relationship that can facilitate in development of our municipality.
Let us fight together towards this common goal. Our infrastructure is meaningless without our people. Let us move together and provide a better quality of life for all citizens.
I think it's very important that us as civic leaders have a voice, and also that we must sit on that table that makes decisions, because we have the direct contact with the people and know exactly what is needed at the ground level.
I think councils are at the core of those programs. We need a seat in all platforms of discussion. That mayors of local council must have representative in meetings, especially that has to do with the health of our people.